Hi, my name's Adam. I'm a student nurse with the University of Detroit Mercy. I'm here to do an assessment on you today. Right. Wash your hands. Right. Patient appears to be sitting upright, dressed appropriately for the occasion, and does not appear to be in any obvious signs of distress. Appears to be well groomed. Right. Can I see your wristband, please? Right. Could you tell me your name? And your birth date?
December 17th, 1992.
All right. And can you tell me where you're at right now?
University of Detroit Mercy.
All right. And why you're here?
Class.
Okay. My patient is alert and oriented ×4. Her mood is appropriate for the situation, and her speech is clear and articulate. I'm going to go ahead with the assessment. Actually, do you have any allergies?
No.
Are you having any pain right now?
No.
No. Okay, if she was in any pain, I would ask her on a scale of 1 to 10 on how much pain she was having, with 10 being excruciating. So I'm going to start with your head. Right. I'm checking for obvious signs of any lesions or hair loss or parasites. There are none. All right. Checking temperature and dryness of the skin. It's warm to touch and dry. I'm going to test your cranial nerve 5. Can you close your eyes for me, please? All right. Can you please tell me when you feel sensation?
Okay.
Okay, and I'm going to check your cranial nerve 7. You can open your eyes for me now. Can you smile for me? Can you puff out your cheeks? All right, can you close your eyes really tight? And can you lift your eyebrows for me? Okay. And, okay, so my patient's ears, eyes, nose, and mouth are all symmetrical. Eyebrows and eyelashes are evenly distributed. No thinning of hair. Right, I'm going to move on to the eye test. Okay, could you stare at my nose, please? I'm testing for constriction. Right, and accommodation. Can you keep your eyes on the pen, please? All right. My patient's eyes are round my patient's pupils are round and equal and are reactive to light and accommodation. Right, and can you open your mouth for me, please? All right, can you stick your tongue out and say ah? All right, uvula retracts. Mucosa is pink and moist and intact. There's no signs of lesions. Teeth appear to be clean, and tongue is pink and moist as well. Lips are slightly dry. All right. I'm going to move on and test your carotid arteries one at a time. Palpitate. Okay, I'd rate those both at a 2+. Now I'm going to auscultate with my bell and test for bruit. Can you turn your head to the side for me, please? Can you blow out and hold it? Okay, and the other side. Same thing. All right, there's no signs of bruit. I'm going to go ahead and listen for your heart sounds. All right. I'm going to start in the right second intercostal space, which is the aortic area. Right, I'm going to move over to the pulmonic, which is the second intercostal space on the left side, and this is where S2 is heard the loudest. Move down the herbs point, which is in the third intercostal space. And this is where S2 and S1 are heard equally, loudest. Right? Move down to the fifth intercostal space, which is the tricuspid area. And then to the mitral area, where S1 is heard the loudest. And then this is where I would hold and listen for 60 seconds for the apical pulse. Right? Then I would change my stethoscope to the bell, and I would move back up in the same direction that I had down and listen for extra heart sounds. Right? Then I would move on to breath sounds. Right. Could you please breathe in for me? Out. In and out. Right, can you raise your arm for me, please? Okay, you can breathe normally now. Right, the other arm. Okay, lung sounds are clear and no signs of adventitious sounds. Right, do it on the back now. Avoiding the scapula and any bony prominences. You breathe in for me. Out. In. Out. Right, breath sounds are clear, no adventitious sounds. Right, can you lean forward for me? I'm going to check your spine. Right, spine is straight. Right, I'm checking for CVA tenderness. Is there any tenderness? No. Okay. All right. I'm going to come back and I'm going to assess the arms. Okay. Skin is warm and dry to touch. Hair is evenly distributed. I'm going to check the brachial pulse. Right. I rate that as at a 2+. Come down, check the radial pulse. And rate them both at a 2+ bilaterally. Right. Check your fingers. There's no signs of clubbing. I'm going to check her capillary. Capillary refills in less than 3 seconds. Right, can you squeeze my fingers for me, please? All right, grip is strong. Right, do you need to use the restroom before I do your abdominal assessment?
No.
All right, can you lay back for me, please? Shirt up. Okay. Patient's umbilicus appears to be midline. She has a couple of nevi. Have you noticed any change of elevation or color?
No.
Okay. If she did, I would do A, B, C, D, and E, and I would also have her tell me or the physician if she noticed any changes. Right, her contour is flat, and I will begin auscultating in each quadrant, starting with the lower right. vowel sounds are active in all 4 quadrants. I will now percuss in each quadrant. Right? The lower right and upper and lower left quadrants were tympanous, and there was dull in the upper right quadrant because the liver is there. I will then palpate each quadrant. Right in the lower right quadrant, we have the appendix. In the upper right, we have the liver. And then upper left, we have the spleen. Right, is there any tenderness? Okay. All right. Just sit up for me, please. Right. Move down. Skin is warm and dry to touch. Feeling the popliteal artery. Right at a 1+. Right. Feeling the skin. All right. Testing for edema. There's no signs of edema. Right. Feeling the posterior tibial pulse. I rate that at 2+. Moving down. Testing the dorsal PDS pulse. I rate that at 2+. Right. Checking for capillary refill. Capillary refills in under 3 seconds. Right. I'm going to do the Dubinsky test. Right. Dubinsky test is negative. Right. I also forgot to check the conjunctiva on our eyes, so I would go back and check. Conjunctiva is pink and moist. Right, can you stand up for me, please? Okay, could you walk across the room for me? All right, and can you walk back heel to toe? Right. Patient's gait appears to be steady and even. All right, and I'm going to do the Romberg test. Could you close your eyes for me? All right, and I would stand here for 20 seconds, noting any swaying. All right. And I also forgot to test the AP diameter, and that would be 2-to-1 ratio. All right, and that would conclude my assessment.